And the reason I didn't have trouble with my doctors with patient education, well, I did when they first came in because they were doing the same thing every other chiropractor, or they weren't doing all the higher sensitivity tests. They didn't know the three phases. They couldn't even explain them. They didn't know the differences in tests as they didn't know the difference between a high sensitivity and a low sensitivity test. So when they first came to me out of school, they were bad. I wouldn't refer any of my family members to those guys, those people. What changed it was a couple of things. Number one, I taught them the basics of spinal biomechanics. I taught them the basics of research, but that's not what had the greatest impact. What had the greatest impact was every day we evaluated patients. So it wasn't just a webinar once a week or a webinar once a month. Every day, first we explained it all. Then we went through the patient, went through their history, and I go, okay, based on these findings, what phase of healing are they? Okay, then I go, what were the biomarkers? What were the primary biomarkers for the inflammatory phase? What were the secondary ones? Okay, then I go, what therapeutics are you going to use for those primary or secondary biomarkers? And how does that therapy work to help that physiology? See, this is how I trained my doctors. And then that's what we apply. Okay, let's go ahead and apply it. And then let's leave it there for 12 treatments. We're going to re-examine the patient in 12 treatments. Okay, so we re-examined the patient 12 treatments later. We pulled up the new exam. Then we compared the test to the first test. We go, okay, let's look at the first test. Where do the second test stand relative to the first test? In other words, they could see it. They could experience it. It was conviction. It was now happening to them. It wasn't just pie in the sky. This is how I created conviction doctors. And knew what they were doing and could justify what they were doing. So then we would go, okay, what phase of healing are they in? Are they kind of out of that now? Can we now pay attention to the second phase of therapeutics? Okay. What were the positive findings that we found in the second phase? What were the biomarkers and what were they quantified? So what therapy are you going to do and why are you going to do it based on those biomarkers relative to the science of the three phases of healing? This is a conversation I had this happened every day. And then we watched again. We go, okay, treat them for the next 12 treatments. Let's go ahead and check them at the next re-exam. We went to the next re-exam. I go, okay, let's look at the biomarkers. Where do they compare to the last? And how do they compare to the first set? So, so now we're seeing tests in the first set that are totally normal now, are sub-threshold. And then we're seeing tests from the second exam that are diminished. And some tests that were more severe, more diminished. In other words, the patient's progressing, getting better as they're going through the three phases of healing and the proper therapeutic protocol, because we know physiologically what's happening. Then we did it again. So by the time we got to the third phase, we are looking at the physical medicine to increase strength and elasticity, because that's what we're mainly dealing with in the remodel phase. And that's what leads to permanent problems when the patient heals wrong, the collagen heals wrong. These fixations, chiropractors know them as fixations, abnormal pathological motor units. That's the number one cause of the number one disability in the United States. The only difference is the cause and effect relationship, maybe 1, 2, 3, or 5 years. That's the only difference. Just like smoking is going to kill 25% of the people that smoke. If it killed them the day they smoked the first cigarette, most people wouldn't be smoking. But they continue to smoke because they don't see it for 20 years. But 20 years later, 25% of them are going to die from that. Well, that's what the tests, same thing. So we're paying attention to these tests. So I know I know the problem, I know the mechanism of injury, we know the healing. We go, well, wait a minute. Out of all these tests, which ones are going to be the last ones to clear up based on physiology? Well, we know joint motion's the last, it's the most important, and it's the last one to clear up. Well, the doctor won't even know it if he's not doing motion studies. He's not doing the most important test for that patient, for that problem. What's the next one? Fixation, tenderness, overpressure. All of those are very highly specific for motor unit dysfunction, but the number one is taking that motion study, going, look at that motor unit. Is it moving normal or abnormal? Because it doesn't matter what else is going on, even if nothing else is going on with that patient. I see abnormal motor unit. I know, just like if my car is out of a line, I know I'm going to have a blowout, flat tire. I know I'm going to have problems. And if I see those motor units abnormal, I know that pathological process is still there, and it's going to surface to threshold. In other words, where they actually start feeling it again. That's what's going to happen. So it's not just based on how they feel. Just like cancer is not just based on how the patient feels. They actually do tests that the patient can't detect and the doctor couldn't detect unless they did the test. And some of those tests are way more important than others. And that's the relativeness of motion studies done 3 months down the road. That gives the earliest indication of the true sense of that patient and where they're at, combined with physical medicine. You can't just not do any physical medicine and then re-x-ray them down the road. I'm like, no. And by the way, a major part of the therapeutic protocol should be the doctor evaluating the abnormal spinal biomechanics of the motor unit, because that is where the physical medicine should be applied. Well, how does he know where to apply that physical medicine if he's not even looking at an x-ray? Well, one way is a fixation, right? Tenderness, fixation, overpressure. That helps to isolate that area. But what's the absolute definitive test? It's the motion study. That's it. So again, how would you like you or family member having cancer and the doctor doesn't even do the highest sensitivity, the most important test that actually tells you if the cancer's gone or not? How'd you like that? Well, chiropractors are doing that they're doing it every day. That's what's happening when you don't explain this to the patient, called patient education. And then you don't give and make it affordable. Remember, we're all about treating patients with respect. We're all about giving patient education, because the average person that understands this, that it's affordable to them and you don't waste their time, will say, yeah, I totally want that, because I don't want these permanent problems to suddenly read the rest of my life. And I would like to get this care. Now, by the way, the lifestyle care is built on the 3 phases of healing, but it's not in the 3 phases of healing patient education. So don't confuse that. And you cannot try to do that. It's separate. So after the patient goes through the 3 phases of healing, they get educated on the lifestyle, and it's not maintenance care. Okay. So the normal patient, if it's affordable and you're not wasting their time, they should go through the inflammation phase, the repair phase, the remodel phase to decrease the likelihood of any permanent residual problems, and then sign up for the affordable lifestyle plan, because they're always going through micro traumas in life every day. And sometimes, wham, they get a major trauma. Most of the time, it's micro traumas. And this is what is constantly treated and monitored as they go through this thing called life. And that's what increases quality of life. No pain, decreased no pain, no restrictions, highest mobility, the best chances of doing your activities of daily living fully and freely with no pain or restrictions, which now does not have a negative impact on your attitude and your relationships. That's chiropractic. That's what it should be.